everyone, a warm welcome to Nextillo for all the present and the future medicos. Of course, it took a lot of hard work to prove yourself as a medical student so far. Trust me, you're going to be facing a lot more challenges and your classes are going to be even more crucial than the ones you've taken so far during your undergrad. Today, we will be discussing on one such rigorous crucial exam that you need to pass to obtain the license if you prefer to practice medicine in the USA. And that's called United States Medical Licensing Examination, which is also called in short as USMLE. How to prepare for the USMLE? USMLE consists of multiple steps. Each step is taken at a different point in the medical career and requires different level of USMLE preparation. Consider each USMLE step its own individual exam that you need to prepare for. The USMLE steps consist of Step 1, Step 2 and Step 3. The Step 1 exam is usually taken at the end of second year. It's a one-day computerized exam that emphasizes on anatomy, behavioral science, biochemistry, microbiology, pathology, pharmacology and physiology. It's a one-day examination that's divided into 7 60-minute blocks and administered in one 8-hour testing session. The number of questions per block on a given examination date may vary, will not exceed 40. The number of items totally on the overall examination form will not exceed 280. Now, let's look into the Step 2. The Step 2 CK is a multiple choice exam that tests the medical knowledge and the essential clinical science required for the patient care. It lasts for 9 hours and presents the subject randomly, so you need to switch between one topic to another without skipping a beat. Let's look into the Step 3. It's a 2-day computerized exam which focuses primarily on the patient management, assessing the ability to evaluate physical examination, order diagnostic tests, select initial therapies, and much more. Based on expert reviews, preparing for the Step 1 exam takes anywhere between 6 to 12 months, Step 2 takes between 4 to 7 months, and Step 3 takes between 1 to 2 months. Of course, every person is unique, having different strengths and weaknesses, so the time will vary according to your study style, according to the time you're going to be spending, your goal in future, your fluency in English, your current foundation about the subject and the knowledge that you're choosing. Now, to begin with Step 1, it's considered as one of the critically important tests where you need a passing score to eventually become a practicing physician. Furthermore, a strong score is the key element in securing a postgraduate residency. The concerned authorities actually rank the USMLE Step 1 score as the most important criteria when they evaluate and consider the applicants. Let's find out how to gear up for this crucial Step 1 test. Analyze the significance of the Step 1. The performance on this test really matters and sets a stage for you for future medicine, as the residency program directors heavily scrutinize these scores. Your Step 1 score is going to determine if you get interviewed for the specialty that you want to pursue. Further, many students educated outside the US are not exposed for the type of integrated clinical definition that is there in Step 1 and not accustomed to the 8-hour testing session. Such factors may cause students to delay studying until they devote an undivided attention for the exam. The full preparation requires not only the firm understanding of the subject matter, but it also needs the ability to integrate the information across the disciplines, apply knowledge for the clinical definitions and questions, and to maintain the stamina to concentrate on the 8-hour examination period. This takes diligent practice, of course, to master this art. You have to start early preparation. Start studying right from the beginning. If you are used to reviewing the material at the last minute before the exam, you need to change that mindset. Studying for Step 1 should take a considerable amount of time. It's a lengthy 8-hour test that covers a vast amount of material, and you need to start practicing early to master this. Understand the USMLE scoring system. The Step 2 exam scores the medical student on the pass-fail basis, and Indian students must pass all the 3 sub-components to get a successful outcome. The assessment evaluates your spoken English during the medical encounters and takes into consideration the pronunciation, your ability to assess the doubts and concerns asked by the standardized patients. It is important that medical students make use of correct medical terminology, maintain detailed documentation, support the diagnosis with important findings, and list them in the right order of the likelihood. Choose the right resources. Unlike other USMLE steps, the Step 2 CS has got very limited resources, so you can stick with the latest edition of the books to practice. The best preparation for the USMLE is the general thorough review of the content that's in the exam description. You should also practice for your exam using the simple test materials and self-assessment information. In addition, the registered examinees who want to actually become familiar with the Prometric Testing Center environment may take a practice exam at the test center for a fee. If you need more information about this test center environment, we will provide you the link in the description box. You can go through the link. USMLE Step 1 preparation is a marathon and not a sprint. Start slowly and gradually. Walk your way up to the optimal performance. Some are able to prepare for 4 weeks, 12 hours each day. Others prefer to study 8 hours each day. Knowing your daily study limits, you'll be more productive in your studies and less likely to burn out. There are some common questions most of the students have. Are strength and English knowledge skills enough to pass the Step 2 CS? The Step 2 clinical skills exam requires each of 3 components to be passed successfully before acquiring the passing grade. You need to focus on which match year you are attending for, how much time you have to prepare, what's your academic strengths and weaknesses. Give yourself enough time to study, but also know that overstudying can also burn you out even before you sit for the exam. Get to know your study style and what works for you. Choose 1 to 3 resources and stick to them, else you will get overwhelmed with the amount of resources out there. Let's look into the change of the policy in the pass-fail scoring reporting system. The USMLE program has changed the scoring reporting system for Step 1 from a 3-digit numeric score to reporting only a pass-fail outcome. A numeric score will continue to be recorded for the Step 2 and Step 3. Step 2 will continue to report as pass-fail, and this policy will take into effect no earlier than January 1st, 2022, with further details to follow later this year. I hope these suggestions and tips provided by Nextillo has given you a fair idea of how to prepare for the USMLE exams. So if you have any more questions, you can always write to us, and do not please forget to like, share and subscribe our channel. Also press the bell icon to ensure that you receive all the notifications from Nextillo. Stay tuned. Good luck.